coming along tonight, our very select audience. I'm Emma Hardy. I'm the European Marketing Manager for Freedom Health, which is an American company. And we just launched over here about a year ago. And want to talk to you tonight a little bit about equine digestive health. So we're going to start off by just sort of looking at some basic sort of nutrition, some basic rules of nutrition, what you should be feeding, how much of it you should be feeding, and then also some equine digestive anatomy as well, so you're clear about which bits of the anatomy does what basically. Then we're going to look at some digestive issues that particularly affect the performance horse, and then I'm just going to touch on at the end about Succeed, which is the digestive supplement that we do. But I'm really keen for this to be very much an educational thing and not a hard sell thing. I don't want you to feel like you've turned up at a timeshare kind of thing with all the doors locked and you can't get out. So if you've got any questions or want anything clarifying throughout, then just let me know. So if we, there we go. So if we think about the horse in the wild, so this is going to be our starting point. So you think about its lifestyle, think about its diet, and this is an animal that's going to be meandering around for about 19 hours a day, eating small bits of grass pretty much constantly. Relatively low stress, unless something's chasing it and trying to eat it for tea. Quite a low stress lifestyle really. So when we compare that to what we do with our horses today in terms of modern feeding routines and modern management, we can see that it's a very different picture. So we've got horses that are being trained, competed, probably stabled for quite long periods of time, put quite high stress, possibly not enough forage, and we're supplementing the diet with concentrates, starches and sugars, high energy components of the diet. But there is one thing amongst all of this that has remained the same, and that is the equine digestive tract. So this is kind of the basis of what the talk is surrounds tonight. This is really what we're going to be looking at in more detail. So I suppose the first thing we've got to ask is, why do we need to feed so differently to how the digestive tract is actually designed to work? And basically it just boils down to the fact that we're asking more of our horses than the wild horse, and the energy demands that we are sort of asking of them, they need to be met by more than just forage. We need to be feeding them high energy nutrition. So we're looking at a diet which is a lot higher in sugars and starches than the diet would normally be in the wild, and possibly a bit lower in forage, and certainly in some circumstances. And this is the basis of where a lot of digestive issues actually come from. This is where a lot of digestive imbalances actually arise from. So if we just look, do some sort of basics of equine nutrition. So some sort of simple rules to go by that you should be following when you're thinking about feeding your horses. You should be looking at sort of 1.5 to 2.5% of their body weight in feed per day. So this includes your forage and your concentrates. The 1.5 to the 2.5, that's obviously going to differ depending on the horse's energy expenditure, its condition, its weight, its temperament, all of these things. So if we sort of go down the middle with it and look at sort of 2%, for a typical 500 kilogram horse, we're going to be looking at about 10 kilograms of feed per day. So the next thing that we need to do is to decide what the ratio is going to be between forage and concentrates. And this really depends on, again, going back to the workload, the condition of your horse, weight, temperament, But generally it would look something like this. So in a very light workload, you'd be looking at a diet which is sort of 10% concentrates, 90% forage, and this can swing completely the other way with, for example, with a racehorse, which can be nearly 70% of their diet is purely concentrates, is purely hard feed, and just 30% is forage, which is obviously, you know, a really small amount. Ideally, what you want to be doing is feeding a minimum of 1% of the body weight of forage a day, or 50% of your ration. So this is what you need to sort of keep in mind. We always hear feed little and often. This is, you know, obviously true with this as well. And it's important, I'll go on to elaborate on this in a minute, but it's important to keep your feeds as small as you can, as often as you can. The main rule to follow is that you don't feed more than about 2 kilograms of concentrates at a time. Okay. So if we take the sort of working example of our horse here, 500 kilograms, so we've got 40 to 60 ratio, so that's 6 kilograms of forage, 4 kilograms of concentrates. That would, you would have to obviously divvy that up into two separate feeds, so you've got 2 feeds of 2 kilograms. Okay. A couple of other things. I'm sure that you're probably familiar with quite a few of these. You know, nothing probably majorly new there. One thing that I think is quite important to point out is that, you know, quite often, particularly if the horse is stabled overnight, the first thing we do when we see them in the morning is give them a feed, give them their breakfast. It's actually better to give them some hay first and then give them their concentrates. Just gives the gut some time to start working, and it also helps digestion of your concentrates if you've already got some forage in there. And again, I'll elaborate on that in a minute as well. So again, feeding according to type and weight, and something that probably a lot of us don't do is actually weigh our feed. You know, it's usually like a scoop of this, or, you know, and there's so many different types of scoops. And so as a rough kind of guide, a stub scoop of mix, you're looking at about 1 kilo. Cubes, just over 1 kilo, and chaff about 200 grams. Bear in mind that from brand to brand, one mix may be heavier than another mix. So, you know, again, it just reiterates it's a good idea to weigh your feed, really, and then you know exactly how much you're feeding your horse. Right, so I'm going to look at the Equine Digestive Tract with my DIY Tract. Homemade, I'll have you know.
Well done.
Yeah, life size, all to scale. So looks a bit emaciated, fair enough. Head's a bit small, not very good conformation. But it just gives you an idea of exactly what we're dealing with. This is all to scale for your adult horse, and it just shows you the sizes of everything, how long everything is, and where all the structures kind of go. Okie doke. Right, I'm sure I don't need to tell you which end is which. So if we start by thinking about when the horse is... Okay, if we start at the start, so the horse is eating. Okay, now this stimulates the flow of saliva in the horse's mouth. Now, unlike in humans and lots of other animals, where saliva is actually it has an enzyme in it called amylase, which is important for digestion. It helps start digestion. Horses have a really low concentration of amylase in their saliva, so it's not really for that function. But it's absolutely brilliant at buffering stomach acid. so naturally buffering it. So what we want ideally is for the horse to produce as much saliva as possible, because that's a good situation. So the horse is eating, swallowed its food goes down to the stomach. It's quite interesting for people to actually see where the stomach is in the horse and how big it is. It's roughly about the size of a rugby ball. It makes up about 7% of the digestive tract, and it's actually a really quite a rigid structure. Any ideas how long food stays in the stomach for? More than an hour? Less than an hour?
About an hour.
About an hour? It's between about 15 to 30 minutes. So it's pretty quick. Okay, so that's where digestion really gets going. The stomach is actually composed of two different parts. The top part, or the bottom part, sorry, actually produces gastric acid. So this is actually where the gastric acid is produced. And it also has protective mechanisms in it to protect that part of the stomach from stomach acid. The top half of the stomach doesn't produce acid, and it's not protected by these mechanisms either. So this is where we often find gastric ulcers occurring, because acid gets up into this very vulnerable area of the stomach, and that's where you get your problems there. So feed comes out of the stomach, goes into 70 feet of long intestine. And any idea how long it takes feed to go through 70 feet?
6 hours.
Any up on 6 hours or any less on 6 hours? Or do we agree? Less? Much less? It's about an hour. Hour and a half, something like that. So it's pretty quick through here, and this is going to be your main site for digesting things like your minerals and vitamins, fats, and your sort of starches and sugars. So all your high energy stuff needs to be digested here. Then at the end of that, it ends up in this kind of sac, if you like, and this is the cecum. In here, there's lots and lots of microbes, lots of bacteria, and these are all here to ferment your forage. So these love your grasses and your hays and your haylage and everything, and they get to work on that and produce a lot of energy. This is where your main source of energy comes from in the horse. And it's in here for quite a long time. It's in here for about 2 to 3 days. So when you've mucked out your horses this morning, that's feed from Monday probably. So once it's been in here, it moves out into the large colon, which is this bit. Again, you've still got a microbial population here and bacteria, so the same thing is going on. And then it goes into the small colon, where not an awful lot happens. You just kind of get moisture is reclaimed really, and then it comes out the other end, and you have to clean it all up every day. So just to show you, that's where the small intestine lies, and then we've got the colon, that's actually the right dorsal colon. So this structure actually runs down, it's a huge structure. The hindgut from here onwards actually makes up about 65% of the entire digestive tract. And it actually runs down the whole length of the horse, the whole side of the horse. So it's, pretty important for digestion, and also, pretty big structure as well. So if we think about how the way that we feed actually affects digestion, so that the types of feed that we tend to feed and the way that we feed it, this is basically what happens. So remember we said that lots of saliva is good. We want the horse to be doing lots of chewing. It also satisfies a behavioural sort of aspect as well. And just to give you an example, if you had 1 kilogram of mix, so one scoop, and 1 kilogram of forage, the horse would have to chew 800 times to eat the mix and 3,000 times to eat the forage. So you're obviously that's a lot more chewing for your forage. You're going to be producing a lot more saliva. The horse is going to be actually chewing for a long time. You're going to keep the stomach fuller for longer. The stomach works best when it's about 2/3 full, and it's never intended to be empty. So if there's anything that we can do to avoid the stomach being empty, then that's the best scenario really. With your concentrates as well, these do tend to move a lot quicker through the tract, particularly if you're feeding intermittently, so you're giving breakfast, lunch and dinner feeds, maybe they're big feeds. Going back to what I said about the stomach, it's really quite rigid, so if you give your horse quite a big feed, it'll go in, the stomach will fill up and it'll just come out, and it'll have a faster rate through the digestive tract, and digestion will be poor because it's not having the time to digest and absorb and utilise all the nutrients. And in that situation, the last thing that we want is any sort of concentrates, any of your starches and sugars getting past this point. The only thing that should ever go into the hindgut is forage.
Can I just ask, do you consider chaff forage, or do you consider it? You don't?
Yeah, chaff is good. It's just really talking about, your cereals, your grains, things like that really that are, not sort of, the digestive tract just isn't really set up to eat lots of them, particularly in large quantities. So if we do end up with any poorly digested starches and sugars ending up back here, it just messes up all the sort of delicate balance of the microbes and the bacteria. We end up with the pH dropping, so it becomes quite acidic, and this encourages the growth of sort of bad bacteria. And this just perpetuates because this produces more lactic acid, which makes it more acidic, which makes the bad bacteria grow more. Good bacteria hate this, so they actually die. When they die, they produce toxins, which can then get into the bloodstream. So it's a really horrible situation that you don't want your horse to end up with. And technically, it's called hindgut acidosis. So some of the issues that we quite often see. I'm going to talk about a few of these. I'm not going to talk about all of them, but I just want to, touch on a few of them. So things like, colic, which is very common, particularly I think this winter when we've had horses stabled a lot. Of course, ulcers, know a lot about gastric ulcers now. And, laminitis, diarrhea, all of these things that are really you come across them really quite commonly. So, what do you think could be some of the signs, temperament-wise, if your horse had a digestive issue?
Grumpy.
Mm-hmm.
My horse is just found out he's an ulcer.
Oh dear.
And that's how he found out. His behaviour changed and he started biting, which he'd never done before.
Right.
And started being very funny about you touching his tummy. And that's how we noticed that there wasn't something quite right, and we found out he's got a stage 2 ulcer.
Really?
Yeah.
So was that brushing, or was that doing the girth up?
It was actually, he wasn't very girthy at all. It was brushing.
Okay.
We thought it may be a back problem, but he started sort of nipping and biting, which he'd never done before.
Right.
He was quite a young horse, and he started all of a sudden.
Right.
And it was, we were feeding him. They said when we bought him that he probably had it, but because we were feeding him, because he was a very overexcitable horse, we were feeding him a low sugar, low starch diet and a constant drip feeding him food. It hid the signs of it. But when he was on box rest over Christmas, when the weather was so bad and he wasn't being turned out,
Right.
the stress aggravated the ulcer, and that's what made it apparent.
Right. So it's something that had been sort of grumbling along, but you've been managing it.
Yeah. So, but we noticed it was his behaviour that changed.
Right. That's really interesting. Yeah. So yeah, definitely, you know, irritability, grumpiness. A lot of horses will go off their feed as well. One thing that our vet does, who works for the company over in the States, is if you give the horse a very cold bucket of water and it refuses to drink it, chances are it's got a gastric ulcer, because it will be quite painful for the horse when it drinks it. So that's one little way you can sometimes, you know, like a DIY way at home, sort of to see for yourself. So, you know, difficulty to train, you know, that kind of thing. So appearance-wise, did you have any troubles with condition or anything?
Really. I mean, he loses a bit of condition in the winter anyway, because
Yeah.
he's got a very high metabolism. But
Yeah.
so we just thought it was him losing weight in the winter, really.
Right.
But he did go off his food, and he is very overexcitable anyway. So,
Right.
but yeah, it was definitely a complete temperament change over a couple of weeks.
It's funny, quite a lot of the stressy horses kind of predispose themselves to getting ulcers, unfortunately. So things, you know, like weight loss, condition loss, coats poor, hoofs poor, that kind of thing. Performance, you know, what we quite often find is that, you know, the horse is difficult to train, but also particularly under saddle, they may have a reluctance to extend or collect, perhaps flex through the body, maybe, you know, trouble with jumping, reluctance to jump. And then clinical signs, so, you know, like your horse, ulcers, you know, diarrhea. If you've got undigested feed in manure, that's a sure sign that the horse isn't digesting its feed. So, you know, there's a whole host of things just to sort of be aware of, that could be indicative of a digestive issue. And I think sometimes we can be quite quick to think, oh, he's being naughty today, or, you know, there's some other reason for it. But I think, you know, if we consider that it could be a digestive issue, it's one thing we can either eliminate or, you know, or help with a diagnosis with that. So gastric ulcers. So we know quite a lot about gastric ulcers now, and they've had a lot of research into them in the sort of last few years, and we generally know how to diagnose them and what kind of causes them. Prevalence, which is we often think that they're most common in sort of top performance horses, things, you know, like your race horses, where the diet and the management is quite extreme. Some horses are just predisposed, and that shows you with, you know, the statistics for the leisure horses. I mean, we're talking about more than 1 in 10, and these are horses that will be, you know, out on the pasture most of the time, and not being worked particularly hard. Another interesting group are the foals. Gastric ulcers in foals are actually really, really common when they're sort of less than a couple of months old, really. Nobody quite knows why. I think the general consensus is that the tract just isn't mature enough to deal with, you know, the protective mechanisms aren't mature enough to deal with a gastric acid. And recently, one study showed that broodmares who were out in the field 24 hours a day actually had a high prevalence of gastric ulcers. Again, they haven't quite put their finger on why, whether it's a hormonal influence or, you know, who knows really. But it's just another group that it's just, you know, worth being aware of, particularly if you do have a stud farm. Generally, gastric ulcers, you know, they are generally a product of you know, sort of modern feeding and management and, you know, training and things like this. But I did come across one study not long ago, which I thought was quite amusing. There was a yard, and they did a study there, and they found that having the radio on in the yard actually increased the prevalence of gastric ulcers. And how many yards do you have I mean, we all do it, don't we? Everybody's got a radio on the yard. But looking into it a little bit deeper, It was actually a race yard, and the radio station was tuned to like a racing channel. So I think the horses just must have thought they were permanently at a race meeting and probably mega stressed out, which probably accounts for why a lot of them had ulcers. So these are just a couple of slides. So you can see on the top left we've got a healthy stomach. That you can see the two different colours, and this actually differentiates between the two different parts of the stomach, where I was talking about the part that produces acid and it has the protective mechanisms, and the part that doesn't. And the division between that is actually called the margo plicatus, and that's quite often where we will find gastric ulcers. So another type of ulcer that we're probably not particularly familiar with is hindgut ulcers. And this is a relatively new thing that we're finding, that horses actually suffer from ulcers in the hindgut as well, specifically in the right dorsal colon. This is a study by Frank Pellegrini, and he actually performed post-mortems, and these statistics actually relate to a performance horse cohort. Now, he had 180 horses that he performed a post-mortem on. He found that gastric ulcers were at an 87% prevalence, no great shock. You know, all the literature says that would be about right for your performance horse. But colonic ulceration was at 63%. So this indicates that we could be looking at about 2/3 of our competition horses actually have a hindgut ulcer. 54% of them had both. A really typical scenario that I hear of a lot is that a horse will be diagnosed with gastric ulcers. It'll be scoped, it'll go on a treatment for gastric ulcers, and be right as rain in 28 days. It'll be scoped clear, and yet the horse still has something going on. There's something just grumbling going on, whether it's not picked up condition or weight, or it still doesn't seem 100% happy. And that's the typical situation where you've got a hindgut problem going on. And it makes sense to really consider the hindgut as well, because when we're talking about the stomach, we are talking about, probably about 7% of the digestive tract, and not an awful lot goes on in there. And it makes sense to actually consider, all of this as well, and what could be going on here, bearing in mind, it's the vast majority of the digestive tract, and this is where your digestion is really, really going on. So we find that going back to the kind of hindgut acidosis situation, we find that that's a really typical cause of colonic ulceration. So it's where we've got this imbalance of bacteria, microbes in the hindgut, and that can cause compromises in the gut lining. And all sorts of problems back there. It can reduce the efficiency of how the gut is working. We find that the symptoms for gastric ulceration and hindgut ulceration are actually pretty similar. But what we do find with hindgut ulceration, there are a couple of things that often pinpoint that you've got a hindgut issue going on rather than a stomach problem, or as well as a stomach problem. Remember that I said that the right dorsal colon goes all the way down the side of the horse's body. So if you imagine that's you and you've got an ulcer there, that's probably going to be pretty painful. So again, you're going to be reluctant to, under saddle, extend, collect. We find that some horses kind of hold themselves and don't fully, relax, kind of let go. And again, flexion through the body. Typical things with the gut not working properly, loss of condition and weight, diarrhea. Again, with the gut not working properly, you're going to be more susceptible to colics as well. Sensitivity of the flanks. So if you're brushing your horse and it's telling you to get lost, that's a good indication. And girthiness as well, which is such a misconception, because people think, oh, the horse is girthy, I'm compressing the stomach, it has stomach ulcers. If you actually look at the anatomy of the horse, the stomach is actually really very high up. You know, where if you're sort of sat on the horse, it's probably about between where your knees are. You're not going to compress that by doing the girth up, but what you are compressing is the end of the right dorsal colon. So girthiness is much more to do with a hindgut issue than to do with a stomach problem. So these are some slides of colonic ulcerations. We've got the normal colon wall up there, and then we've got an ulcer, a carbuncle. So that's sort of an infected area, and a parasite there. And then this is actually the inside of the right dorsal colon. So we're looking inside this structure here. And the big red blob is actually a 5 centimetre ulcer. So this was actually taken directly from one of the post-mortems. So you can imagine if you've got that in your hindgut, you're not going to be very comfortable. So, diarrhea. Really important. If your horse starts to get diarrhea, you want to stop it as soon as possible. This is 2 slides from a healthy intestinal tract and a scarred intestinal tract, which is from a horse which has had chronic diarrhea. So normally in the intestine you've got all these sort of finger-like projections, and this is to improve surface area. So you've got as much surface area as possible to have as much absorption as possible. When you've got a horse that's having diarrhea over a long period of time, all these finger-like projections get flattened, and you've got a much reduced surface area. So you're going to lose your absorption, your digestion. The horse isn't going to be getting all the nutrients that it should be getting. Colic. Okay, so if we had 100 horses over the space of about a year, we'd be looking at a colic episode in about 4 to 10 of them, and 7% of them would actually be fatal. It's the #1 medical cause of death in the horse. The only thing that's more likely to sort of kill your horse is old age and trauma. So it's pretty serious, really. Some of the risk factors, so again, going back to what we talked about earlier with inactivity, the horse is being stabled for prolonged periods of time. This can have an effect on gut motility, and this is where you can start getting your impactions. Bute toxicity. So bute, actually, if you're feeding bute for a long period of time, this actually affects, again, some of the protective mechanisms in the hindgut and causes problems back there. Cribbing and wind sucking. Interestingly, wind sucking, if your horse wind sucks, it's 70 times more likely to colic than a horse that doesn't. So these are really, really well correlated with colic. And again, going back to diet, big, acute changes in diet, and diets with lots of starches and sugars will predispose the horse to coming down with an episode of colic. Okay, so going back to acute changes in the diet. So with acute changes, basically the bacteria and the microbes in the hindgut are all set up for the type of diet that you're feeding the horse. If you suddenly change it, all these need to change in order to be able to digest it, and that's why you need to make changes in diets very gradually, so you give all the bacteria and the microbes a chance to convert to what they need to be to digest the new feed that you're feeding. And this also links in with laminitis as well. So just going to go back and sort of talk about the hindgut acidosis situation again. So with this situation, we talked about colonic ulceration, hindgut ulcers. We're also leaving the horse a bit more vulnerable to colics. If it's not working properly, fibre digestion is shutting down, could have problems with motility, blood sort of perfusion, all these things that could end up in a colic. Going back to with the release of endotoxins from the death of all the good bacteria, this can actually cause laminitis because it will enter the bloodstream and end up in the little capillaries in the hoof, and that's how it will cause laminitis. It's starch-induced laminitis. Okay. So, what can we do to prevent it? Well, basically, what we really want to do is just try and get the diet and the management as close to how the horse would be, you know, naturally in the wild. So we want to be thinking about feeding as much forage as we possibly can, as much turnout as we can, you know, all pretty sort of common sense things really. Again, really try and avoid this empty stomach situation. So, you know, giving your hay before your concentrates, making sure, you know, if you ride first thing in the morning, give the horse a hay net whilst you're mucking out or tacking up or something, just so it's got something in there to mop up the gastric acid. With an empty stomach, all this acid, because it's continually produced in the stomach, it doesn't just get produced when the horse eats something. So if the stomach is empty, you've got gastric acid, you're then asking your horse to jump or to gallop or to do whatever, and you get it all sort of sploshed about, and that's how it can end up in this, you know, vulnerable part of the stomach without the protective mechanisms. Alfalfa hay is actually very good for horses with gastric ulcers as well, because it's got a higher calcium content in it. It can be very good for helping to buffer your gastric acid, you know, naturally. And again, you know, if you can cut back on your cereals and your grains as much as you can, then, you know, that's an ideal situation. But, you know, we do appreciate that if you've got a horse that is a competition horse, is a performance horse, you do need to be feeding these high energy concentrates in order for it to, you know, achieve what you want to do. So one of the other options is something called functional feeding, and this is, yes.
Going back a little while, it takes a bit of time to sink in sometimes. And you're saying it takes a long time for some of these hard feeds to be digested and work through. If the horse is going out for an event,
yeah,
and there's not much point then in feeding it competition mix the night before. You need to feed it a couple of days before.
Well, with your competition mix, you know, and like your starches and your sugars, your high energy things, these are quite fast release. It's, you know, it's things like the kind of scenario you're talking about would apply more to your forages, which is more of a slow release energy. So do feed your horse the night before, because it, you know, that's the fast release energy that it will be using the next day. Okay, so I'm just going to talk a little bit about Succeed. Succeed is termed a functional feed. So this is looking at you know, foods and their components beyond just their nutritional properties, but also looking at the functional properties that they can have. So what Succeed aims to do is to get the tract into A1 condition. This has got to be your starting point. From that point, you can maximise digestion, absorption, functioning, resilience to any digestive issues. You know, that has got to be where you've got to start. So with Succeed, it's kind of like a two-pronged attack, really. It's got nutritional properties that are kind of give the gut the tools in order to kind of help itself, in order to renew itself and to obtain, you know, this sort of really great health. The other thing that it does is actually has a physiological effect on your concentrates, and actually helps them to be digested a lot more naturally than they would be, you know, normally, and almost like how forage would be digested, which I'll elaborate on in a second. So the nutritional properties I'm talking about are things like your polar lipids, amino acids, nucleotides. So these are all things that are involved with strengthening the integrity of the gut lining. Okay. The other thing with Succeed is that it'll look after the entire digestive tract. Please don't think of it as just a stomach supplement or a hindgut supplement. We treat the tract, as one thing. So that's what Succeed does. Excuse me. We've also got a mycotoxin absorbent in there as well, which is a prebiotic, and this will help to restabilise the hindgut. So that's great for the hindgut. And then the functional component of Succeed is beta-glucan. So when we're feeding this alongside our concentrates, what this actually does is creates like a gel in the stomach with your concentrates. So do you remember I said that concentrates move quite quickly through the digestive tract? So if you've got a sort of gelling agent, we're keeping the stomach fuller for longer, and then we're moderating the passage of feed through the small intestine, which is where we want to get everything digested, all our starches and sugars, all our concentrates, want to get them all digested in there. So it just moderates the passage of feed, make sure that there's nothing poorly digested ending up in the hindgut. Okay? So we're looking at strengthening the tract, improving the health, and normalising the transit rate of concentrates through the digestive tract. Beta-glucan also absolutely brilliant for stimulating the immune system as well. If you're into breeding at all, it's very, very good for improving the quality of mare's colostrum. And because it's a completely natural supplement, you can feed it to any age of horse, whether foals or adult horses. And on days of competition, it won't contravene anything. So you could use this as a treatment to help recovery, and or you could use it as a preventative measure. It was initially developed as more of a preventative measure, particularly for performance horses, and then we found it was pretty good at actually clearing up digestive issues as well, whether stomach or hindgut. So targeting the entire tract, targeting the root cause of a problem. We don't want to be masking a symptom or treating a symptom. And working naturally, with the natural digestive process. We're not messing around with any of the, normal digestive processes. We want to work with what the horse has naturally. So although we have to, it is necessary for us to feed, modern feeds and the way we feed them and management in order for the performance horse to be able to meet the energy demands that we place on it. If we can create a situation where we can give the horse all the energy it needs, but also get the tract into A1 condition and have that working optimally, then that's the best sort of situation all round, really. Okay.
Is this something you feed sort of continuously from now till whenever you want to stop it, or is it a program that you put them on for a period of time, or is it a continual supplement?
In an ideal world, you'd have the horse on it all the time. Theoretically, if you have a horse that is having a holiday and it's gone in the field for 6 weeks and you're not riding it and it's only eating grass, shouldn't need it. But everybody will use it differently. Somebody might use it just to help recovery, might use it for sort of 2 or 3 months, get the horse right, and then they may be able to make dietary changes, management changes, so the horse isn't going to be susceptible and have a relapse. Ideally, you'd put the horse on it, get it right, and then use it as a preventative measure. But everybody's budgets are individual, and their horses are individual, and it's down to the owner at the end of the day. But
how much does it work out?
At most, it works out at about £2.10 a day. We do different sized tubs, so at the at least it's at about £1.80 a day. We do say that if the horse is on this, you shouldn't need any other supplement apart from a joint supplement if that was necessary. And sometimes We find that with some horses, because they're optimising, you know, their digestion and they're getting all the nutrients out of the, you know, expensive feed that you're buying, sometimes they can put on weight, condition, you can drop back on your hard feed a little bit, so you can save a little bit of money on feeding bills occasionally.
And how long would it say the largest tub, how long would that last?
180 days.
180?
Yeah, yeah. We do a granular form, which is a top dress granule, and you just sprinkle it on top of your concentrates. And we do a paste as well, which looks like a wormer. But it's very palatable. Horses actually really like the taste of it. I personally think that the paste is better if you're using it, you know, as a recovery, because it's a surefire way that you know that all of it's got into the horse. Whereas more of you know, I think the granules are more suitable for a maintenance kind of situation, really. So
the tube, the syringe, would you just use that once, or is that something you have to use every day?
Every day.
Every day.
Yeah. You do a loading dose for the first week, so you do 2 a day, and then once every day. And you need to give that just before your concentrates, because it's working with your concentrates as well to, you know, make sure that they're being digested as optimally as possible.
So if you're feeding breakfast and dinner when you're going to once a day, which would you?
I recommend morning.
Morning.
Yep, because even if horses don't run out of hay through the night, they naturally have this spike of gastric acid at about sort of 4 or 5 a.m. So I definitely think that it's of more benefit in the morning than at the end of the day. The thing is, this is your fuel line. Without getting this right, you can't expect any of the other biological systems to be working as well as they could be. You know, this has got to be a starting point. In terms of, we do have horses that do well with Temperament on this. The beta-glucan, which is like the gelling agent, actually binds sugars, and it actually releases them quite, you know, slowly, so you don't get any glycemic, you know, peaks and troughs. So we do find that it can have a good effect on Temperament. And another study that we did with weanlings during weaning, so quite a stressful time, those that were on Succeed had lower cortisol levels than those that weren't, which is a marker of stress. So, you know, quite often we do have positive, you know, I mean, if the horse is grumpy and fizzy or whatever because the tract isn't working right, then that will obviously help that. But there are other aspects to it which will be beneficial on Temperament as well.
Yes, because obviously you can scope a gastric ulcer, but I guess you can't do anything to diagnose.
This is why really the whole hindgut ulceration thing we've just been in the dark about for so long. Sometimes you can find that the horse has got a low protein level through doing bloods. Another way is to ultrasound the hindgut, and you find that there's thickening of the colon wall, but that can be quite difficult to interpret, you know, vet's fees and all the rest of it. We are actually bringing out this spring, summer, a completely non-invasive fecal testing kit, which is a really, really clever piece of kit actually. And it basically uses a fecal sample, you mix it with some water, you pipette 2 drops into an antibody cassette, and it tells you 2 things. It tells you that the horse has got a blood loss or a protein loss coming from the digestive tract, and B, whether you're dealing with a stomach problem or a hindgut problem.
And when will that be available?
Probably May, June, and that'll be through your veterinary practice. It'll be about £25, so very affordable. You don't have to put your horse through starving it or sedating it or scoping it or any of these things. You know, you don't need to even touch the horse, just its poo.
Do that every day?
Yeah. So yeah, that will be available in the sort of spring, summer, and I think that will be really important in bringing, you know, taking forward the sort of hindgut ulcers, and actually really showing us exactly what's going on with the hindgut and diagnosing a lot more of them.